Hey, so I had a 72-year-old male patient who presented with hypotension to the ER after having a regularly scheduled paracentesis performed that removed 6.7 liters of fluid due to ascites in his abdomen. The patient has a history of liver cirrhosis, pulmonary hypertension, type 2 diabetes, coronary artery disease, and ascites with frequently scheduled outpatient paracentesis. The patient was alert and oriented ×4 and was able to walk to the bathroom and get up and down from the bed with very little assistance. During the assessment, the patient had a temperature of 98.2, which was normal, a heart rate of 103, which was elevated. Blood pressure was 85/59, which was low. Respiratory rate was 14, which is normal, and his oxygen saturation was 96% on room air, which was normal. And then he had his glucose was 101, which was actually considered normal for this patient. The patient also reported having pain in his back periodically to a previous fall the week before, but stated he was feeling better at the time of assessment. The pain started a week prior, and he stated that it comes and goes with movement. He described it as aching. Rest and medication relieved the pain, and the patient was prescribed tramadol PRN for the pain. At the time of the assessment, the patient rated his pain a 2 out of 10 and did not want medication for the pain. His lung sounds were diminished. He had abdominal distension and rounding due to the ascites, and he had a total of 400 milliliters of urine output for the day. The patient was prescribed albumin 25%, 25 grams intravenously for his hypotension to try to raise his blood pressure. He was also prescribed midodrine for the hypotension. He was on Novolog, insulin, PRN for type 2 diabetes. Riocugout, I don't know if I said that right, and Selexipag was for, he was prescribed for his pulmonary hypertension, and then he was also on tramadol PRN for the pain. So the patient's problems today were the hypotension, having the low blood pressure throughout the day, the ascites in the abdomen, and then the high blood sugars after meals. The short-term plan for this patient was to have the patient's blood pressure increased to 95/65 or higher to increase within the normal range, and then to maintain his pain to a 2 out of 10 or less. His long-term care plan to prevent his readmission back into the hospital would be to refer the patient to a dietitian to educate and continue the patient with his con-carb diet for type 2 diabetes, and then the renal diet, which to reduce the incidence of ascites and prevent him from coming back into the hospital. The patient will go home with his wife and his son, who will also help with his care as well.